Hello.
Hi, hi. I'm Wanda,
And I'm Janelle.
and we are lactation consultants here at PHFE WIC. Welcome to Ask the Lactation Consultant. We apologize for the delay. We did have some technical difficulties. Hopefully, you all are sitting tight and you're okay. Um,
So this is breastfeeding month. August is National Breastfeeding Month. So we are here celebrating, and we're so happy to have you all here with us. So thank you guys for taking the time out to come and be a part of this with us today.
so we're give us one moment.
We're a little more technical difficulty. Sorry about
There we
that.
go. Okay.
There we go. So August is the start of National Breastfeeding Month. And WIC, we help families feed their babies with support that they can count on. We serve participants and their families from many cultures and many communities. Parents can get support from peer counselors, lactation experts. And this month, we recognize and support the support that makes breastfeeding and chest feeding possible. So in the month of August, the first week is World Breastfeeding Week, the 1st through the 7th. The 8th through the 14th is Indigenous Milk Medicine Week. August 15th through the 21st is Asian American, Native American, and Pacific Islander Breastfeeding Week. August 25th through the 31st is Black Breastfeeding Week. And the September 1st through the 7th is Workplace Lactation Week, which is very important. And then finally, we have Semana de Lactación
De la Lactancia Latina.
Latina, and that's from September 18th to the 14th.
Yeah.
So the theme of National Breastfeeding Month is together or forward together. So the U.S. Breastfeeding Committee celebrates unity, solidarity, and hope. This year honors the strength of advocates and organizations working to improve access to human milk and drive lasting change.
Yeah, and one tidbit of information, while we have National Breastfeeding Month universally, it is Breastfeeding Week, that first week in August. So this is something that is recognized worldwide. Although in this country, we do National Breastfeeding Month. So our breastfeeding support groups, PHFE WIC offers monthly breastfeeding support groups in 6 different languages. We have English, Spanish, Chinese, Vietnamese, Tagalog, and Thai. And this is amazing to be able to join a breastfeeding group that speaks your language. What's going on? Okay. So again, this is our Facebook Live event where we ask the LC. So earlier today, we had English that was hosted by Josie and Jessica, and all of our hosts for this Facebook event are IBCLCs or lactation consultants. We now have us, Janelle and myself. And then also later today, we'll have another one that will be in Spanish, and that will be hosted by Jessica and Maria. And then next week, on the 21st, we'll have a Chinese Facebook Live. I'm sorry, not next week, tomorrow. Sorry about that. That's hosted by Wendy and Connie. My apologies. I got to get my reading glasses on. All right.
All right, so we open the floor to your questions, and I see a lot of mommies in there. I see a few people in the chat box. If you have any questions, any questions for us, we are here for you.
And while those questions are coming in, we'll address some of the kind of the basic questions that we hear a lot from moms just in regards to milk supply or painful latch. Um, so like for milk supply, some moms will ask, when does my milk come in? Because we do have moms right after they have the baby, they expect that the breasts are going to be full and have all of this flowing milk, but that is not how that process works. Go ahead.
Yeah. So the first 1 or 2 days, we generally have, or you may have heard about colostrum, which is the first milk that comes in at the beginning. And a lot of moms see that and they see that, oh, it's just a few drops, and they get a little nervous and we want to start giving formula. We encourage you not to do that.
Mhm.
We encourage you to latch as much as possible, because latching helps to move your body into the second phase, which is the transition phase where your milk starts to come in. And that usually comes in maybe the third, fourth, fifth, around those days, you'll start to see a difference in the milk. So yeah.
One of the things that moms are a little surprised about is that in the beginning, the milk is it's clear, it's colostrum, and they're nervous that it's clear, expecting again that you're having this flowing milk. That clear colostrum is very, very important for you to provide to your babies, because it's very concentrated, has loads of things in there, antibodies and a lot of other things that are very important to keep your baby healthy, because they just got into this world. So that clear stuff is very important. You're not going to get a whole lot of it, but continue, providing that to your baby. Ask for help if you feel like you need some help.
Yeah,
What else?
absolutely. So some of the other questions that we kind of get in the beginning, we hear a lot of regarding milk supply is, how do I know if my baby is getting enough? That is a big question that
Yeah.
we hear in the beginning, and we're actually happy when we hear that question, because that means you're paying attention. You want to see what's going on with your baby. So we love to hear that question. How do I know if my baby is getting enough? And there are a few ways that we tell mommies like how to monitor, or things to kind of look for to make sure that baby is getting enough. The first thing is, right when we're latching baby, we're listening for signs of milk transfer. We want to use all of our senses. We want to hear baby sucking. We want to see baby swallowing. Those are all signs that baby is getting something. So if baby's at the breast and we're not seeing sucking, we're not hearing swallowing, that should be our first instinct that, oh, maybe I need to contact my friends here at WIC.
Yeah.
Yeah.
Yes.
Also, we want to make sure that baby is giving us output. So remember that baby can't give us any output, which is the poops and the pees, without input.
That's right.
Right.
Yeah.
And so there's a number of diapers that we should be getting each day that kind of tells us how baby is going.
Yeah. And the other thing that I bring up during that time when they're asking that question is just remembering there was a time we didn't have bottles. And there was a time when moms had to literally not only depend on their own maternal instincts or their instincts, but also they had women around them who had been breastfeeding and had the experience and were able to kind of support and coach. So that, I'm just going to go back to our support group meetings, that those are so very helpful for moms to exchange information and know that you're not going through these things by yourself. But just as exactly like Janelle said, watch for the output. If you're not seeing much output, and it's going to depend on the day, the first day as opposed to the 7th or 8th day, you'll see a different output. And then just ask. That's what we are here for. We have peer counselors, lactation consultants. If you attend those support group meetings and you have moms there that you may have connected with, and are able to ask questions. So yeah, that's exactly one of the questions that we hear a lot. Even, let me see, we've got other questions regarding latching and pain. I know we're still kind of hearing breastfeeding should not hurt. That's one. Anytime you feel pain, you need to ask for help. I know one time there was a mom that said she breastfed for 2 weeks because it hurt. And, that kind of broke my heart because I'm thinking, we're here, we're here, just ask. And we can fix that so that you can continue your breastfeeding journey for as long as you want and not it be inhibited by pain or something else. So it should not hurt. Latching, wide mouth. I'll get
big,
my
wide open mouth.
wide open mouth. So baby is literally latching onto the breast, not the nipple. And I've seen babies suckle from the nipple, and mom is, that's not good.
Yeah. We have a question in the chat. So I have a mom that says that my baby chokes sometimes and it scares me. I sit him up and he still chokes sometimes. He was born at 37 weeks and was in the NICU. Not sure if that has something to do with it. Gigi, how old is he now? I mean, and how are we feeding him? Is he feeding directly from the breast or with the bottle? So there's if you are feeding baby with the bottle, there's a method that we like to use that's called pace feeding. And it's a way that we hold the bottle so that to kind of, I kind of want to think about it. She says babies.
Yeah.
So we kind of want to think about it as we're teaching baby to breastfeed, but with the bottle, right? And so the way that milk comes out the bottle is very different from the way that milk comes out the breast, right? And so and she says she feeds baby with the bottle. So what we want to do is we want to try to, traditionally what we see on, this is my light skinned baby today. So today, I mean, what we normally see on TV, everybody feeds baby like this. Everybody's like, oh, I gotta feed my baby, right? And so what they're kind of do is they're laying baby flat, they're holding the bottle in a diagonal, and the milk is just coming out. Baby doesn't have to work very hard. Baby's just moving his mouth a little, and the milk is coming out, right? They don't have very much control. So with pace feeding, what we're doing is we want to try to hold baby more upright, and we want our bottle to be more level with the floor. And so what that causes baby to do is it causes them to work, right? They have to move their little mouth. They have to we actually want them to open their mouth a little bit wider, get more of the nipple in their mouth, and then they have to move their mouth. Okay. So to get the milk out of the bottle, right? And so we want to use that. And what that also does is it kind of helps them with their digestion. It helps them to kind of move milk slower. I mean, move milk from the bottle into their body so it's not coming in so quickly. And it also helps with spit up and moving not drinking so quickly so that they're not choking. Also teaches them to kind of slow down because when they get older, when they're toddlers, we're constantly telling them, slow down, eat your food. And so it's kind of like teaching baby that same thing.
Yeah. And that can keep baby from choking if you're feeding the baby slower, because as that milk is coming out and it's just coming out, they just suck, and they just get full, and that's where you might have some spit up and the choking. So yeah, try pace feeding to slow that down so you don't have maybe even some digestive concerns or that the choking. Yeah. Thanks for that question. Let's see. What other questions do we have? Keep them coming. Let's see. Oh, okay.
I think maybe to hear you, let's try you demo
All right.
the way the camera is.
Okay. So again, the baby is going to be upright. And like Janelle mentioned, if it's this way, then the milk comes and it just doesn't stop. So you want to have the baby upright. The bottle is horizontal or flat. You don't want to fill the bulb of the nipple. It's okay that baby receives air because you're going to burp, and you might have to burp frequently. So when you're feeding the baby, the bottle is horizontal. You let some of the milk go in there. Don't fill it. And if you're having to tilt it up a little bit, then you can tilt it down to let some of the milk come out of the bulb of the nipple, and then allow baby to just suck. Now, again, like Janelle mentioned, as far as breastfeeding, when babies breastfeed, they're going to suckle a few times before they get a mouthful of milk. Different than the bottle when you're going like this. You just get a mouthful of milk constantly. So especially if you're going to keep baby at the breast, you don't want to have too many bottles. But when you're bottle feeding, allow the baby to suckle a few times. So then they'll get a mouthful of milk and then they'll swallow. And it's okay for them to take a break. Again, I am stressing it's okay if baby gets some air in there because you're going to burp. So horizontal, don't fill the bulb, let some milk go in there. Baby will suck, 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 get some milk, swallow. And when baby is swallowing, you can lean the bottle down a little bit and then put it back up. So how does that work for you, Gigi? Let's see. While we're waiting for that response, maybe pumping and storage. We have so many questions that usually come through. And sometimes moms are having to pump and store the milk. So one of the questions we have, how do I express and store my breast milk?
Yeah. So in general, I like to tell moms, think of the rule of four. I think sometimes we say 4 or 5, but think of the rule of 4 when we express milk. So maybe not in these days, because I mean the next couple of weeks, because it's an extreme heat warning. But when the temperature is a little bit more tolerable outside,
A little bit cooler, yeah.
breast milk is good. Once you pump, it's good for 4 hours, just fresh out, right? So fresh on the table. In the refrigerator, it's good for 4 days. We want to try to make sure that we're not putting it on the door, that we're trying to put the milk back into the back of the refrigerator. And then in the freezer, it can be good for 4 months to up to a year. So it's really important that we're storing the milk properly. That way it's fresh for our babies. We did get a question, and mommy says, my baby has a tongue tie and has a frenectomy scheduled for tomorrow. Okay. What will it be like, and what's the recovery like?
Well,
All
that's a
right.
good question.
Frenotomy.
Yeah.
I'm sorry.
That's okay.
So a frenotomy, for those of you that don't know, so the anatomy of our tongue, right? We have a little
Piece of skin.
that's underneath our tongue, right? And so sometimes that skin is a little bit too tight. And so when we're trying, the mobility of our tongue isn't as mobile as it should be. And so baby needs that tongue to move and do different things as they're breastfeeding to get that milk to come out, right? Because the tongue is working, it's massaging, and we want the tongue to be able to move freely so it can do what it needs to do. So if you have that little restriction, the tongue may not be able to move as much as we would like it to. And so this procedure is to kind of, some people use a laser, or some doctors use a laser, some doctors use a,
They snip it.
they snip it. They loosen that skin underneath there. And so for some mommies, for some babies, right away, as soon as they're done, they're able to latch on. Most babies, they're able to latch on right after, and we encourage you to do that. Your doctor should provide you with some like exercises or some aftercare to kind of work on. And we encourage you to reach out to us too, so we can help you as well as getting baby latched on.
Yeah, the aftercare exercises that they usually get, although sometimes I hear that moms don't actually get those exercises, but it can help because sometimes that skin under the tongue or frenulum will grow back. And so you want to conduct those exercises per doctor's instruction to be sure that it doesn't grow back. Because if it does and baby is struggling, then you might have to do it again or leave it alone. There are some benefits. Definitely, if mom is struggling with breastfeeding, then it's great to have that. The specialist will let you know if they recommend it or not. And then the family, you all will choose whether to have it done. So if mom is really struggling with breastfeeding, that can absolutely be beneficial because baby is able to breastfeed easier and mom doesn't struggle with pain. Sometimes what some of the studies have shown is that you have the frenotomy done or they have it clipped or lasered, and then it doesn't seem to help. And in that case, there may be some other things going on. Of course, we don't know. You would check with the specialist. But it is a decision that the family has to kind of figure out whether they want to have that done or not. And they don't always let parents in while they're doing that procedure. And it can be, for parents that might be a little bit rough because it's rough even if, your baby is having to be poked and have a blood draw. That can be traumatic. So it just depends on how you would respond to that. But the baby is screaming, they're holding the baby down and mom and dad are, freaking out. I don't blame you, but you may or may not be able to go in the room with the baby. So, but it's something that can be beneficial. Yeah.
Yeah. I have another question that we got, or a comment that we got is, I've been to WIC almost every week that I had him from July 9th. You guys are the best. Oh no, you're the best.
Thank you. It's so great that you came in. I'm
Yes.
telling you, it makes a difference for you and your baby if you get that help. And that's one of my things. I'll probably keep saying it, but just if you need help, please ask us because that's what we're here for. And I don't want you to have to struggle unnecessarily because
Yes.
usually if it's latch or milk supply, it's a relatively easy, it can be a very simple fix. So just reach out.
She continued that I have some exercise that I've been doing with WIC. They gave me a nipple shield. Oh, in the meantime. And shout out to Telma and Eric.
Yeah. Okay. Yeah. That's great.
Yeah, Erica is an excellent PC. She's great. I love her.
Well, a comment regarding nipple shields. I'm so glad that that's helpful to you. It is a breastfeeding tool. But I do want to say, if it's something that you don't need, don't use it. It can be a hassle and I know, and I'm gonna be honest with you, I'm kind of old school. Because there's so much stuff out there, gadgets, tools, all kinds of things that you can do now, stuff you can get to put on your boobs that are already warm instead of just using, put a towel under some hot water, and stick that on your boobs.
Yeah.
But whatever it is. But sometimes when it comes to breastfeeding, there's so many things out there. If you don't need it, you can play with that stuff, absolutely. But sometimes it gets in the way.
Yeah.
And it can make things a little bit more complicated or just more difficult. But nipple shields are an excellent tool, and I'm glad that you were able to get that and it worked for you.
So for those of you that don't know what a nipple shield is, like Wanda mentioned, it is a tool. It comes in different sizes. We highly recommend that you work with a lactation consultant.
Absolutely.
If you're using one, because if you're not, it can cause more damage than good. But this is a sample of what one looks like. There are lots on the market. There are many on the market, which is why it's really, really important that you are working with a lactation consultant. But it's a thin silicone. I can't remember words.
That's okay. We're working together here.
So it's a thin silicone device that we put onto the breast, and it helps mom. This is not the way that we would, but there is a specific way that we would apply it to the breast, and then it allows baby to be able to latch onto the breast. And so there's certain circumstances when this would be really, really helpful. And so that's why we highly encourage you to work with a lactation consultant, because like Wanda mentioned, we don't want it to become a hindrance. Because if you don't need it and you start using it, then baby is used to it. And then you leave it at home. And then now what do we do? So the less tools, the better. But if you do need to use a tool, that's there are things that are available to you.
And if those aren't used properly, then you can get into trouble just in terms of how much baby is able to remove. So if you're having pain or whatever challenge and you feel like you might need something like that, again, that's what we're here for. Don't hesitate to contact us.
Yeah. And Whitney, I'm really glad that it was helpful to you and helping you to continue your journey. We want you to breastfeed as long as possible. So I'm glad that you were able to use that as one of your tools.
Yeah. What else do we have? Oh, there's a couple of questions that we have here. One is, how often should I breastfeed? And that, you would first breastfeed on demand. When you have a newborn, you want to make sure that you wake the baby if baby isn't waking on their own. Because the more frequently baby feeds, then we're pretty good with that weight gain. If baby is sleeping like 3, 4, 5 hours, and I'm going to be honest, I did that one of my kids. The kid was sleeping, the baby was sleeping a lot, and the baby lost weight. And I'm thinking, because I was raised, when people are sleeping, you let them sleep, and then when they wake up, then you can have that exchange, whatever that is. That's not true for newborns. Don't do that. Wake that baby if baby is not waking up, so they can get that nutrition and get that food, so they can put on weight and not lose too much weight. They need to be gaining. They'll lose a little bit or some in the beginning, but you don't want them to continue losing weight. So on demand, if baby is waking frequently, then that is perfect. If not on demand, for that newborn, you wake about every, I'm going to 2 to 2.5 hours. So you're feeding no later than the third hour. And then, like Janelle was talking about before, watch that output. You know, you need to be changing diapers frequently to be able to know that baby is getting enough to eat. So you breastfeed frequently.
Yeah, and kind of what that looks like is you feed baby at 5 o'clock, and if baby does not ask you to eat by 7 o'clock, then you want to offer it. And especially if baby doesn't want to eat by 8 o'clock, we definitely want to wake baby up, make sure that they're eating. So every 2 to 3 hours, if baby's not asking. If they want to eat before, that's great.
Yes.
We don't have to wait until 7. We can go ahead and let them eat ahead of time. But every 2 to 3 hours, at least, we want them to be eating in the beginning. Once they get a little bit older, their belly's going to get a little bit bigger, and so those feeds will be spaced a little bit farther apart. But definitely in the beginning, like Wanda mentioned, every 2 to 3 hours we want.
Yeah, definitely. And keeping in mind, if for whatever reason that you're using formula, formula will sit in the gut longer than breast milk. Formula is not human milk, it's cow's milk, or it might be soy. But because of the processing and yada, 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 it's harder for the body to digest. So it sits in the gut and babies will stay asleep longer. And I know that might sound like a good thing, but for the baby, that's not necessarily a good thing. We want babies to be aroused early and eat frequently to keep them from getting into a deep sleep and allowing them to eat frequently. So you will see, if you give a baby formula, they will stay asleep longer. Breast milk, they are going to wake, and that could be every hour and a half to 2 hours. That's normal sleep. That's normal, and that's okay. And you know what? The kids will grow up, and I know it's hard. Got 4 of them, and you think you'll never sleep again, but you will.
Yeah, it's good. We want them to have that good brain activity going on.
Yes.
We don't want
Yeah.
them too deep in that sleep.
That's right.
That's good. Another thing that we always get is how long should a feeding last? So in the beginning, we're always really, mommies are worried, we're worried, everybody's worried, right? And so most nurses, and definitely here at WIC, you're going to probably hear 15 to 20 minutes, 15 to 20 minutes. We want to put baby on one side, and we want them actively feeding. So we kind of talked about earlier the sucking and the swallowing. You want to hear that going on for 15 to 20 minutes while they're there. So if baby starts to fall asleep, or they've only been feeding for about 5 minutes, or maybe a little bit less than that, and they start to fall asleep, we want to wake them up. We want to remind them, hey, you got a job to do. Your job is to eat, and we want to see you eating. So at least 15 to 20 minutes. After they're done on one side, we are gonna burp baby. We're gonna offer them the other side, and we want to try to get them going for another 15 minutes on the other side. And that's in the beginning. As your baby gets older and your baby becomes a breastfeeding superstar, they're going to be able to latch on, get what they need,
Yeah.
and move on. They got stuff to do.
Yeah. They become
So,
very effective.
Yeah. So
Yeah.
that is a very common question. Like, how long should you breastfeed? So it depends on the age of your baby.
Another one is diet and lifestyle. And so one of the questions is it okay to drink alcohol or caffeine while breastfeeding? And the answer is absolutely not. And I am kidding. I am totally kidding. Okay. That was a joke. Yes, you can. You can, but you want to just kind of pay attention to what you're doing. in terms of both of those, they can affect your baby. So for caffeine intake, we usually say about 1 or 2 cups of coffee a day. You probably want to wait until you want to breastfeed first and then drink your coffee. And that will allow the baby to avoid that caffeine. If maybe you drink your coffee first and then you fed the baby, just kind of pay attention. How is the baby reacting to that? Because, babies are a little bit sensitive or maybe not. They might, get a little jittery or what have you from the caffeine. Just next time, just make sure that you drink your caffeine after you feed the baby. And then alcohol is always okay. You want to
Yeah, just drink it all up. No, I'm kidding. Please don't.
Oh my
Please don't.
God.
We are absolutely
yeah.
joking. So with alcohol, of course, we want to try um to plan, right? So it depends on what your plan is, right? It's your birthday, and on your birthday it's gonna be party time.
Mm,
So your birthday is 3 weeks from now. So we're gonna plan
yeah.
and prepare for that birthday night
That's right.
celebration.
Oh yeah.
So we're gonna pump and we're gonna store, and then that way we have milk uh ready and available for
Mhm.
that party time.
Mhm.
And then during the time when we're drinking, we are not going to feed baby. We're going to give baby this reserve milk. You may need to pump if you're away from baby for whatever amount of time that you're going to be away from baby. You may need to pump during that time, but we want to wait until we want to give ourselves time for the milk to the alcohol
yeah.
to clear itself through our bodies, and then we want to get then we can start pumping again, or providing our baby with the milk.
Mhm.
They also make on Amazon and different things. They make
See, here we go with the gadgets. Here we go with the gadgets.
test strips for
Yeah.
milk, but I would say you definitely want to, if you're feeling tipsy, then you don't want to provide your baby that milk.
Yeah.
So
Yeah, you can, and pay attention to your body, because if you're feeling tipsy or drunk or whatever, that the alcohol in your system is a little bit high, that's going to go to your baby. So once you feel better and you're not having the effects of alcohol, then that's a better time, or the time when you might be able to, where you can feed your baby. Because however you're feeling and that stuff is in your system, that's what you're going to be giving to your baby. So if you're going to party, and nothing wrong with that, go out and have a good time and do what you need to do. Exactly what Janelle said. Plan ahead, pump maybe once or twice a day, because the time that you're out, the baby is probably not going to have any more than 3 or 4 bottles, but pump enough to have that milk available, enjoy yourself. And then once everything gets back to normal, what have you, I don't know, then go ahead and breastfeed.
yeah,
So just plan.
plan ahead.
Yeah.
Please make a plan.
Yeah.
And call us. We'll help you. We'll help you come up with a plan
Yeah.
for your birthday celebration.
And they have there's
Oh yes, in
yeah.
the chat there's some recommendations by the CDC, and it talks about alcohol and also other outside products going into your body.
Yeah.
One thing that we did kind of touch on a little bit is latching in position. That is a big one that we get. Mommies ask us questions about latching in position all the time. And one good question that we always get is, what if my baby has a poor latch, or how do I know that my baby is latched correctly? So I'm gonna handle that.
Well, a couple of things that you would pay attention to. One of them is fairly easy. If baby isn't latched correctly, is you are going to hurt. It's going to hurt, and you're going to have pain. That tells you baby is not on that breast correctly. And typically we see that when baby is on the nipple. Okay. Not supposed to be here. The tongue kind of cups the nipple. The nipple goes all the way to the back of the mouth, where it's not being rubbed by the tongue. Sometimes it can feel like sandpaper on that nipple, but if you have pain, something is wrong. Please understand that and internalize that, because moms think, girls, we got periods, we got pregnancy, we got delivery, we got all this stuff. We got pain all the time at some point. Breastfeeding is not supposed to hurt. Honestly, if you haven't had a baby or even if it's been years or whatever, and you're breastfeeding, you might have a little bit of irritation, and that should go, no, it's supposed to go away. If that irritation stays, get help, because I'm telling you, the nipples can crack and bleed. That's not necessary. Okay, so pain is going to be one of the things that tells you that latch isn't going too well. Another indication that latch isn't well is if baby's not gaining weight. If baby is not gaining weight and losing weight, that means there's no transfer of milk. And WIC is here for you to get those weight checks. We used to, before COVID, we were open every day. Now we are not. So call ahead. You can go in for a simple weight check. Those of you who aren't, don't feel like having a conversation, just telling you want to go in there for a weight check. You get the weight check and then you can go. Sometimes if you go in there, you can take care of your appointment as well. But lack of weight gain is another indication that latch is not good. And so there are a couple of positions because you want to be comfortable as well as the baby. And so as far as, I'll show you one, maybe Janelle can show you another one or two. I like for newborns, I like cross cradle because it allows you to have a little bit. Is it really? Yeah, you have more control.
Yeah.
And so you want to make sure that baby is elevated and close enough to you. Baby needs to be turned towards you 100%. The body does not need to be facing upward or kind of upward. You want the baby, because you don't want baby to feed like this. You want baby to have full frontal towards you. And you can, when you're using cross cradle, well, not for real, but I'm breastfeeding on the left breast. You're going to support the baby with your right arm. Support the base of the skull with your hand. You want to try to not stay up here because it's uncomfortable for anybody. To have somebody have their hand behind your back, you kind of push back a little bit. So when you're doing it, hopefully you can see this pretty good. Baby is going to get that wide mouth, and you're going to pull baby in, not trying to break the neck or anything, but you want to pull baby in such that the nipple will go to the back of the mouth. And then you can readjust yourself so that you're cradling the baby like this once you have a comfortable latch. And there are some other, minor things. If you come in and you need some help with latch and positioning, we're happy to do that. What other position do you like?
So cross cradle is my favorite, especially for newborns, because you get to hug them tight and they get to
I love it.
You're in control of their neck.
Yeah.
Right. So that is my favorite. The other is football hold. Yeah. Football hold, the same rules apply. Always remember, baby's belly should be facing you. So it's the same thing. Baby's on the side. We're going to have their legs behind you, and you can use this arm to support them underneath. And then, so when I was breastfeeding, I didn't have these boobs, but now that I have these boobs, right, they're much bigger, right? So it gives it gives mom a better view, right? So some moms, especially if you have larger breasts, it's good because you can kind of see. And we're doing the same things. We're pointing our nipple at baby, the top of baby's nose or their lip. And once baby gives us that big wide open, then we're bringing baby into the breast. And this helps you to kind of support them. If you have really large breasts, you can also put something underneath you can use a sling or a receiving blanket to kind of support your breast underneath, right? And then that kind of helps you and baby. It kind of gives you a little less pressure on you to hold everything, right? But definitely, especially I have a lot of moms that are worried, like I'm smothering the baby or I'm smashing the baby, which the baby is fine. If the baby can't breathe, violence. If the baby can't breathe, they will let us know. We got a question in the chat while we were talking. Someone asked about THC. So THC goes into the fat, right? When you inhale or however you, maybe not inhale, however you intake marijuana or THC into your body, it goes into the fat. So it stays in your body a lot longer. So there isn't an amount of time that you can take in marijuana and then breastfeed, right? It stays in your body. So we don't recommend breastfeeding after exposure to marijuana. And I don't think there has been any testing done to say how long it stays in your body quite yet.
Yeah, well, it'll be in the body. The last I heard it was around a couple of months, and give or take, because it is stored in the fat, and your fat doesn't readily release a lot of stuff.
Yeah.
It's not water soluble,
Mhm.
so it takes a little bit longer, and that
Yeah.
you can transfer that to the baby.
Yeah. And we know for sure that there are effects from THC. There's cognitive effects. It can be long-term consequences that we don't specifically know about. So we really discourage THC or marijuana use during pregnancy and during breastfeeding.
Yeah.
And especially during pregnancy because they may do testing on baby when baby is born. And even though marijuana is legal use in California, baby cannot have it in their system. So we especially discourage it both times,
Yeah.
during pregnancy and during lactation.
Because once you deliver the baby and in the hospital, and if they find whatever in the baby's system, then you're putting yourself in a difficult position, you know. So that's
avoid
a
it
lot of
altogether.
extra. Yeah. Yeah.
Yeah. So we've got 10 more minutes. So any more additional questions, please feel free to let us know. Yeah, position. We said cross cradle,
Yep.
football. There's also laid back
Yep.
position, which is also
Yeah.
my favorite.
Yeah. Yeah.
Side lying, where you're laying down, baby's laying in front of you. But yeah, there's a lot. But the most important thing is that it's comfortable for you. You
And the baby.
yes,
Yeah.
you and baby we're gonna give you when you come into WIC or you meet with your doctor, they're gonna give you lots of positions. They're gonna give you, oh, do this, put your hand here, do this, hold the baby this way. But what we want is we want you and baby to find your flow, your comfort, your what position works good for you, because that's you the two of you are going to be at home by yourself.
Yeah.
So we want you guys to find your comfort level when you're breastfeeding.
Keep in mind also in the beginning, when babies are newborn, there's a whole lot of work that happens during that time. It is temporary. It's hard to be patient, and your body is doing different things, and you're having to take care of this baby, new baby, plus some other babies you might have, and all that whole thing that goes along with that. Hopefully you have some support. But after a while, what will happen as the baby gets older, man, when they learn how to breastfeed and breastfeed well, those babies are going to get that boob any kind of way they can get it. They will breastfeed upside down. They just need to get their mouth to the right place and they're good. So it will absolutely get better. One of the questions was, when should I consult an IBCLC? Call WIC and we will connect you, whether it's with a peer counselor, because that program is amazing because it provides you prenatal support so you know some of the things to expect. And believe me, that makes a difference in your breastfeeding journey, because stuff happens sometimes, but when you know the basics ahead of time, it can make your journey so much easier in the beginning. So just call us. If you feel like you're struggling, even if it's a little bit, call us. So it's not a particular time that you would, call for the help of an IBCLC or breastfeeding help. Just call and we will help you. And then, it's taken care of. And if you need to stay with us a little bit longer and, in receiving that support, then that's fine, as long as you're doing well.
Yeah. And even if you feel like things are going good, but you're still feeling a little hesitant, or you just need that boost of confidence, we have what's called a pre and post feeding. And so that's what happens is you come in, we weigh baby, then we will help you with breastfeeding baby. So if there's any concern about position, we'll help you with that. Or if you're a pro, that's fine. We're gonna feed baby, and then after we feed, then we're gonna weigh baby again.
Yeah.
And then the scales that we have at WIC are very, very sensitive. So we're able to to see the difference in the weight. And we can kind of see, oh, baby is getting about this much. And so that can be a big confidence boost. And we're all about supporting you and giving you as many confidence boosts as possible.
Yeah, definitely. Because we want our babies to breastfeed. And remember, the benefits of breastfeeding are not only for baby, it's for mom also. It reduces your risk for female cancers like breast cancer, uterine cancer, those kinds of things. It also reduces your risk for some other things like cholesterol, diabetes. This affects your breastfeeding affects your long-term life or life in the future, how healthy you can be. So remember that it's not just for baby, and it makes a huge difference in baby's health. So it actually lowers their risk for childhood cancers and a bunch of other stuff. So breastfeed those baby as long as you possibly can. Right now, the AAP Academy, American Academy of Pediatrics is recommending 2 years of breastfeeding. Remember, in the beginning, it's a lot of breastfeeding, and as they get older, then it's just every now and then. That's up from 1 year. And around the world, they're breastfeeding till 3, 4, and 5. Breast milk is amazing, and it supports your baby's brain, immune system, this whole thing for years. The longer you breastfeed, the more protection and antibodies that your baby has long term, not just for the time that you're breastfeeding. So please keep that in mind. I mean, we're strong, as women, we're strong. We can make our babies stronger.
Yes.
Yeah.
Yeah. Another one we always get to when we talk about breastfeeding for long is I don't want to spoil my baby, especially as African Americans.
Yeah.
It's a big thing. I don't want to spoil my baby. We want a strong bond and like connection with our babies.
Yeah.
And definitely, of course, feeding them with the bottle, you're going to have a bond, but feeding them directly from the breast, there lots of skin to skin. There's this, you guys are talking, your bodies are talking to each other. You're able to physically talk to each other at the same time. So it's a really, you're creating this bond, and you want your baby to be connected to you, right? You want your baby to know, I got you and you got me, right? So you're building that bond in the beginning. And trust me, you can't spoil a newborn.
Right.
So enjoy that snuggling and skin to skin and being close to each other as much as possible.
Yeah, definitely.
Yeah.
And there are some moms that literally cannot breastfeed for one reason or another. And when I say that, that is because something hormonal is going on, or there might be some illness and they cannot. Some moms, just some things are going on and they can't. So particularly for those moms who cannot, that can be heartbreaking. And it's still important. You talked about not spoiling our newborns. Hold those babies. I know that we've kind of come around because that is our thing. You're going to spoil a baby.
Yes.
You're not going to spoil the baby. That allows the baby to trust you and be able to know that mom and dad, or whoever the family, is going to be there for them. It actually helps them to grow and do better because they have that connection with whoever is taking care of them. And I was saying that to say, if you can't breastfeed and you have to bottle feed, then you be the best parent that you can be. Breastfeeding doesn't make you a fantastic parent. You need to know how to have a good idea how to parent, because we're not really taught how to do that so much. But definitely breastfeeding can help support the immune system and brain growth and all of that kind of stuff. So it's really important babies get that if they're able to get it. Yeah.
And if you can't breastfeed, skin to skin, skin to skin.
Yes.
That's
I remember. I tell you, I remember. That's amazing. Just holding your baby. I miss it. My kids are grown. Would never do that again, but I have really good memories. So yeah.
Thank you guys so much for joining us. We just have a few more minutes. So we did put in the chat box our breastfeeding hotline. And if you can't see the hotline number, it's 888-278-6455. And our breastfeeding hotline is Monday through Friday, 9 to 5:30. Please call us. We want to help you. We want to answer your questions, and an hour is just a short amount of time, but if you call us, we'll be able to work with you and give you what time you need, be able to answer what questions you have.
And we have a CinnaMom event coming up
Yes.
next week
Yes.
on the 28th.
28th. So there's
Yeah.
2 events next week. On the 27th is our virtual support
That's
group.
right. Yeah.
So we'll be back at it again.
Yep.
So if you can join us next Wednesday, and then on Thursday we have an in-person event, and it's to celebrate our 10-year anniversary.
Yeah, for CinnaMoms. It's amazing. It's an amazing program. Oh
Yes.
man,
Yeah,
I love
yes.
it. Yeah, I love it.
Yes. So
So,
please, if you're able to come out to the
Yeah.
CinnaMoms location, we have
oh, Erica and Tia will,
yeah,
I think, yeah,
Erica
both of,
and Tia will
yeah,
be there.
yeah.
So the moms that mention them, you'll be able to see them in person.
Yeah, yeah. Those are our peer counselors, so people will be there for you to meet and greet in person.
Yeah. So thank you guys so much for coming, everyone that was able to join.
Yeah.
And
We
thank
hope
you
to
for your
see you soon.
questions.
Yeah.